Hi everyone, this is Dr. Van Bosch with the V Boutique. I have put together a short presentation for everyone to learn a little bit about the new drug management for obesity. These are very exciting new drugs that have come to the market and everybody's asking about it, and we decided to bring them into the V Boutique. There's a lot of unknowns in this area, there's a lot of confusion, a lot of stuff on social media, so I decided to put this together for all of our patients to really learn about it. So here we go. So first of all, I think this drug, or I should say these two drugs, are very social media famous these days, were brought into focus by the Kardashians. As you can see here, they really lost a ton of weight in the past year or maybe less. And this, of course, went blitzkrieg on social media and everybody started talking about it because everything that they touch becomes like that. But in reality, these drugs have been available on the market for a little bit longer than that. And even before the FDA approved them for diabetes and weight loss later, a lot of people were using them in their clinics for weight loss, a little bit under the radar because it wasn't approved yet. But they became very famous recently. Now, we want to first talk a little bit about what obesity is and why it's so important to treat it. And I'm not just talking about people that are extremely obese or overweight, but really anybody who has some excess weight and why it's so important. So first of all, the CDC defines an adult with a body mass index of 30 or higher as obese, and adults with a BMI or body mass index of 25 to just under 30 as overweight. So neither one of those are ideal. The other thing is that the obesity rate has steadily increased since the initial survey in 1962. Back then, only 23% of Americans were obese. In 2017, 42.4% of American adults were obese, and that's by CDC data, and that's in 2017. As you know, post-COVID, these numbers have climbed up significantly. So what is the BMI? BMI is your weight in kilograms divided by height in meters. So if you think about that, this is basically the scale of weight. The BMI of 18 to 24.9 is normal. So say if you're someone who's 5'7", 5'6", and weighs about 130 to 140, 45 pounds, you're right in there. If you're 110 or less, you're probably underweight. So these are your good ranges. Anything over BMI of 25 falls into the category of overweight, obese, and extremely obese. So once you step into, say, 150 or more, you're definitely overweight for someone who's 5'6" or 7", and so on and so forth. If you're more than 35% body mass index, that's extremely obese or morbid obesity. So if you look at the statistics for obesity here, we can see, according to National Center for Health Statistics, that only 28.4% of Americans are basically of normal weight. Okay? So that's really, I would say at this point, about a quarter of us. Almost 32% of Americans over 20 years old are overweight. 32.1% 20 years old or older are obese, and 7.7% are severely obese. Again, this statistics is a little bit older, but we know that post-COVID, all of this got worse. So more than 3/4 of Americans are overweight, obese, or severely obese. And here in this chart, you can see based on date of birth, if you look at the percentage of obesity and the age, you can see the chart. Basically, as we get older, we get bigger and bigger. So by 2 to 5 years old, already almost 14% of Americans are overweight or obese. 6 to 11 years old, 18.4%. By the time you're 19, 20% of adults or children under 19 actually are overweight or obese. And by the time we hit our 20s, 30s, 40s, to 50s, then the numbers get really scary. You know, almost half, 42, 43% of adults are obese. So why this is so important? I mean, we all know obesity is not good for you. Like, we know that being heavy is not good, but do we really know what that means? do we all understand that obesity is not just about not looking good, about having maybe arthritis, maybe having heart disease, hypertension? Do we really know all the other diseases that are associated with obesity? If you really think about it, obesity is associated with, and this is all research that has been going on for years, a lot of mental disorders, anxiety, depression, panic disorders, attention deficit disease, cardiovascular disease, hypertension, heart attack, heart failure, all kinds of diseases that are related to coagulation, such as pulmonary embolisms, a lot of skin issues, such as psoriasis, obviously osteoarthritis. There's a lot of fatigue, physical impairment, back pain. They're actually associated with a lot of infections because obesity is associated with immune suppression. And people who are obese tend to get a lot sicker, a lot more, many different infections. Pulmonary diseases are associated. Sleep apnea is a really big one, and it's very, very common these days. And sleep apnea can actually cause sudden death. It can cause severe hypertension and all kinds of other issues. Reproductive issues are affected by obesity. We know in addition to infertility, something that's very common these days is PCOS, or polycystic ovary syndrome. And that's actually skyrocketed in the recent years, and it follows the epidemic of obesity, and that's related to insulin resistance and obesity. Type 2 diabetes, obviously very closely associated with obesity. Fatty liver disease, this is a silent epidemic these days. I will talk about that a little bit more. Very scary. Dyslipidemia, which is high lipid levels in the blood, gallstones, gout, and something you may not know of, but it's pretty much proven in science that a lot of malignancies or cancers are associated with obesity, especially colon cancer, breast cancer, and pancreas. Breast cancer is very important there. So these cancers are much more common in obese individuals. So again, obesity, type 2 diabetes, high lipids, cancer risk, mood disorders, heart disease, reproductive disease, liver disease, again, very important, and hypertension. So one step behind obesity is insulin resistance, and this is even a bigger animal. This is the big sort of elephant in the room. This is a scary silent epidemic that affects a lot of Americans and all over the world, but especially in the Western world. So what is insulin resistance? Insulin resistance is, insulin basically is the hormone that our pancreas produces to take the glucose into our cells. And glucose, or blood sugar, is the main fuel for the body. So insulin's job is to make sure that the glucose goes into the cells so cells have energy. And it also does a lot of other things, but that's its main job. And it controls blood glucose very closely. Now, insulin resistance happens when our cells in our muscles, fat, and liver, which are the main sources for insulin uptake, they just don't respond to insulin. So insulin tries to get the sugar into the cells, but it can't. So our body keeps making more and more and more insulin, but at some point it just basically stops working. So blood sugar becomes unstable. This is the first stage of becoming a diabetic. And this is very interesting because as of now, we know that 50% of population in the United States are insulin resistant, and that sets you up for metabolic disease. It is also present in many individuals who are healthy and not overweight, but just happen to be sedentary, leading a sedentary lifestyle, even in young people that look healthy. And it is associated with obesity, cardiovascular disease, non-alcoholic fatty liver disease, which is basically when your liver starts becoming fatty, it turns into fat as a result of insulin resistance. Metabolic syndrome, which is the precursor to all of these other conditions that we talked about. Polycystic ovary syndrome, high triglyceride levels, which sets you up for heart disease, hardening of the arteries or atherosclerosis, and high blood pressure. So before you even are having signs of obesity and you know that your weight is creeping up, you could be having this condition. So what are the causes of insulin resistance? Some of them include, obviously, the first one, the most important one, is excess body fat. And you don't have to be, again, obese to have this condition. You can have a little bit of excess fat in the visceral region. What that means is the fat that sits around your intestinal tract and inside your body. So not the one that you pinch and it's sitting outside of your muscles. That's the fat that is external to the inside of the muscles or the around the organ area. So that is the fat that, when surgeons do a tummy tuck or we do treatments to melt the fat or inject Kybella or whatnot, that's the fat that we try to melt. The one we don't see, but actually causes increased girth, and it becomes a problem in postmenopause, especially in women. We gain a lot of fat in the visceral region, and also insulin resistance is a problem, is the visceral fat. It's the fat that's around the gut. That is also correlating with a waist measurement of 40 inches or more for men and 35 or more for women. That's a sign of insulin resistance. Physical activity is a big one. And in fact, the studies have shown that even a single session of moderate intensity exercise can increase glucose uptake and decrease insulin resistance by 40%. Diet, obviously very important. Diet of high processed food, high carbohydrates, saturated fats has all been linked to insulin resistance. And here's a big one, hemoglobin A1C. Let me just explain what this is. Hemoglobin A1C is basically a marker for diabetes and insulin resistance. So hemoglobin, as you know, is a big component of the blood, is the part of the blood that carries oxygen. And in individuals who have insulin resistance or high blood sugar, it basically becomes glycated, meaning that a glucose or a sugar molecule attaches itself to it and it changes its structure. So when it's elevated, we know that there's a metabolic issue. A normal hemoglobin A1C should be lower than 5.7. If it's elevated above 5.7, between 5.7 and 6.4, we know that patient has insulin resistance. So now let's get to the good stuff. Why do we keep getting fatter? So we know everybody talks about, and everybody has heard the message, try to cut back on your calorie intake, try to exercise, try to do this, try to do that. So we all know that, and people try it many times, and they might lose a little bit, but they keep failing. I think it's because 95% of diets fail, I think really because it's rooted in willpower, not biology. So I kind of liken it to, before, the birth control medications and devices came on the market, the only way to, the only messaging for avoiding unwanted pregnancies was abstinence. So how many people did actually do that? People just abstaining from sex is really not a very good way for good contraception. Same thing with food. When you're hungry, it's as much as you can rely on your willpower, it's not enough to really be able to lose weight and maintain the weight loss. I think about weight loss as a sprint and a marathon. You need a sprint in the beginning to lose some excess weight, to have a good start. And you need a marathon because you need to continue that. You need to have some tools to really maintain a healthy diet and lifestyle. And hopefully you can do that. But once you lose most of the unwanted weight, maintaining it can be a little bit simpler if you stick to some basics. I also think health is not just a lack of symptoms. If you think about that, it makes sense in the context of that insulin resistance, because insulin resistance has no symptoms, but you know that you're ill based on what we talked about. So here comes the topic of the drugs that can really help us in the journey to weight loss. So what are these medications? There are two main ones. One is semaglutide and one is tirzepatide. So semaglutide and tirzepatide are what we call incretins. Incretins are gut hormones. They're naturally made in the gut, and they aid in digestion and control of blood sugar. So these medications are basically incretin mimics. So basically they are very similar to these peptides or these molecules that our bodies make to control our blood sugar. There are two types. There's a GLP-1 or glucagon-like peptide 1, and there's a GIP or glucose-dependent insulinotropic polypeptide. These are semaglutide and tirzepatide. So semaglutide is a GLP-1 receptor agonist, and tirzepatide is both, is GIP and GLP-1 both. And that's why I prefer this one a lot, and I will tell you why in a few more slides. In a 28-week clinical trial, tirzepatide increased the insulin sensitivity and secretion while decreasing levels of glucagon. Now, here's a little graph that shows how these hormones work. So this is GLP-1, which we talked about is semaglutide. So what it does, it works on the brain by suppressing the appetite. It also has neuroprotective effects on the brain. In other words, it helps your brain health. This is one of its main effects, is that it delays gastric emptying. So food sits in your stomach a little bit longer and you won't be hungry. It increases insulin secretion and decreases glucagon secretion from the pancreas. It increases insulin sensitivity. If you remember, we talked about insulin resistance and why the cells in our body lose their ability to use insulin properly and become insulin resistant. So it helps here. It helps transport glucose into the cells inside the adipose tissue or fat and in the muscle, and also helps glucose uptake by the liver, or uptake of the sugar by the liver, which is very, very important in glucose control. It also has cardioprotective effects, which we'll talk about. These drugs are actually very good for your heart. And this is GIP, which is very similar. It does a lot of the same things. It has a little more effect on the brain. It also has healthy effects on the bone, increases bone formation and decreases bone resorption. So you can see that they have many good benefits. Now, so what are their benefits again? What do these drugs do, and why am I so excited about them and started offering them at the V Boutique? First of all, they offer significant, consistent weight reduction. When you're on these drugs, you will lose weight. No ands, ifs, or buts about it. Everybody might do it at a different rate, but it will happen. It decreases cravings. It's very interesting because when you're on these drugs, you lose a lot of your food cravings that hamstring a lot of people when they try to lose weight. Cravings for sugar, for salt, for alcohol, for a lot of these things. It just basically vanishes. There's a lot of talk that it might adjust your metabolic set point, that weight that your body wants to go to when you try to lose weight every time you plateau. There's a lot of talk that it might actually reset that. So you're allowed to go to somewhere a little bit lower than that weight that your body seems to be stuck on. It actually lowers, now watch this, lowering death by cardiovascular causes by 26%. This is no joke. These medications work. They're protective, not only because they work on your glucose levels and metabolism and lower and help your weight, but because they change your lipid profile. So they improve your cardiovascular health. They lower hemoglobin A1C, which we talked about as a marker of diabetes. They reverse fatty liver disease. And like I said, this is a silent epidemic right now. As a lot of you know, I'm a radiologist in addition to being an aesthetic and regenerative medicine board certified physician. So I've been looking at CT scans of abdomen for 20 years. And it used to be very rare that we saw a fatty liver. Nowadays, I would say that I see it more than I don't see it. And it's become a silent epidemic. It's a problem. It's the number one cause of liver transplantation now. Liver cirrhosis and transplantation, number one cause forever used to be alcoholic cirrhosis, or sometimes or hepatitis. But now it's because of diabetes, overweight, and being overweight, and fatty liver disease. It improves liver function tests. This is insulin sensitivity, which we talked about. It reduces the visceral fat, and this is very, very important because we've never been able to do this. Even when you lose weight through diet and exercise, that visceral fat tends to be extremely resistant, and it does not want to go away. And as we know, it's closely associated with those health markers. So reducing visceral fat is a very important feature of the drug. They're very safe. They don't have the typical side effects of prior medications that we used to have in the past that created a lot of agitation and high heart rates and high blood pressure. They don't create any of that. And the other thing is they can be used for long-term for weight management. There's no limit on how long they can be used. So I'm going to tell you what I think about these two. And it's actually not what I think. It's what the studies have shown. They're both pretty good. But if you put them next to each other in large randomized controlled trials, patients receiving semaglutide, which is now approved for both diabetes and weight loss, they lost a mean of 6% of body weight by week 12, 12% by week 28. But in contrast, Tirzepatide recipients achieved a weight loss of 6%, 21%, and 22% during that time, 22.5%. So almost double the weight loss. Meanwhile, the side effect profile are similar. If anything, tirzepatide has lower side effects. 55 and 63% based on the dose of people taking tirzepatide achieved at least 20% body weight reduction compared to 1.3% taking placebo. In other words, when they put these people that they took in research, two groups of people, large groups, thousands of people, put them next to each other. They told both people to try to do some exercise, and they introduced dietary modifications. And in the placebo group, which did not receive the actual tirzepatide, but was given a placebo, say sugar pill, they lost only 1.3% of body fat. The tirzepatide group lost 20%. So that's a massive difference. It tells you how effective this drug is. And research also showed in these randomized controlled trials that tirzepatide at all doses, low or high, was superior to semaglutide for weight loss. And here you can see, I'm going to show you a couple of graphs and then we'll move on quickly. This is where I say you don't need to be really a statistician to read a graph. Very simple. This is the placebo group that I told you only took a sugar pill. They didn't know what they were taking, in other words, or a sugar injection. And this is the group that actually took the medication. And you can see the semaglutide group lost all of this weight and the placebo group not. There's a huge difference, as you can see here. The amount of weight loss is quite astonishing, the difference between the two. This is just to show you how many clinical trials have been done comparing semaglutide to all kinds of different medications. There's so many of them, and they're ongoing. They're called sustained trials. And we have, I think, about 20 of them now. And here's another one that shows continuous follow-up of these drugs up to 55, 56 weeks. This slide shows you that the difference in semaglutide and placebo in what I talked about, fasting insulin, serum insulin, which is a marker of diabetes. You could see that the placebo group, the level is higher than semaglutide group. And these are very statistically significant differences. And these are the liver enzyme markers that show the semaglutide group is a lot less. Now, this is even more impressive. I wanted to show you this because if you look on the left-hand side, you have the semaglutide group, once weekly injection. On the right-hand side, you have a placebo group again. And you can see the weight loss differences. These are in kilograms, which is each kilogram is 2.2 pounds. So you have to say this times 2.2 is the amount of weight loss. And this is the amount of weight loss on the semaglutide group, and this is the placebo. Big difference. You can see that they lost almost 7 times more weight. This is the visceral fat mass. This is very, very impressive, which was I was talking about. 0.36 kilograms is about a pound of weight in the inside linings of surrounding the stomach. So this is a very impressive loss of visceral fat, which has important health implications. And as opposed to the placebo, which was much less. Now, again, tirzepatide versus semaglutide once weekly. This is the reason I keep bringing this up, because I want to encourage everybody to use tirzepatide if they can, but they're both good drugs. So if you compare them, the hemoglobin A1C, which is that health marker that I talked about in your blood, the target was to get to 5.7, which is normal. This was met in 27 to 46% of patients with tirzepatide and only 19% with semaglutide. So you see, again, double or almost 4 times as much, actually a little bit more than double, in tirzepatide group achieved those good levels of hemoglobin A1C. They also had almost twice the weight loss in comparison to semaglutide. And this is very impressive. Most important thing is that weight reduction did not plateau in any of the treatment groups at 40 weeks. In other words, with most diets, as you know, as you go on, you plateau, you stop losing weight. With this one, it did not plateau. You can continue to lose weight. Many patients who received tirzepatide also noted an improved lipid profile. So the cholesterol came down, the lipid profile improved, the blood pressure came down, the biomarkers of insulin sensitivity and liver enzyme levels improved, which we talked about. And they think that's because of that dual action of both GLP-1 and GIP that we talked about. And here's the very important slide that shows actually the difference between tirzepatide up here and semaglutide. So these are 3 different doses of tirzepatide. versus semaglutide. Semaglutide is the gray and tirzepatide is in blue. So based on the dose of tirzepatide, there's different degrees of weight loss. This shows the percentage in weight. And you can see here that, this is the glycated hemoglobin. This shows the degree of loss, lowering of hemoglobin A1C, which is higher in all of tirzepatide groups as opposed to semaglutide, which is in gray. So tirzepatide lowered the hemoglobin A1C more than other ones. And I think everybody can use that. And here's another really important one, compares body weight change. Everybody wants this between tirzepatide and semaglutide. Again, semaglutide is in gray and tirzepatide, different doses, in blue. And you can see that all the groups, even the lowest dose of tirzepatide, lost more weight significantly than semaglutide. Now, again, no joke, this is still a great weight loss. It works. But in comparison, tirzepatide did more. And you can see the graph here as well. All the blue group lost more weight. And these are percent of patients who met their weight loss target, 80% at the higher doses of tirzepatide versus 54% at the higher dose with semaglutide. So in summary, what are the differences between the two? Tirzepatide is the newest form of weight loss medication. It's recently approved for diabetes type 2. Now, because it had such an impressive effect on weight loss, it is being fast-tracked to be FDA approved for weight loss, and it's expected to arrive sometime in late spring. Glutide is a GLP-1 antagonist created for type 2 diabetes and FDA approved for 2019 for that and 2021 for weight loss. Now, tirzepatide works on both GLP-1 and GIP we talked about, semaglutide only GLP-1. Brand name for tirzepatide is Mounjaro. Brand name for semaglutide is Ozempic or Wegovy. Average weight loss with tirzepatide was 22.5%, for semaglutide 10 to 14%. Quick look at this in terms of side effect profile. If you can see, these are side effects. Typical side effects are nausea, diarrhea, vomiting, and constipation. They vary amongst people quite a bit. Some people tolerate these medications really well and have no symptoms. Some people get a little bit of an upset tummy. Usually, though, the medication side effects improve within the first few days to weeks. As you can see, they peak a few days later and they come down. So the medication side effects across the board improve. The most common one is nausea. I tried it, so I can tell you that for me, it was like being a first trimester pregnant. It just felt a little bit, I just didn't like the sight of food, and you really don't want to eat that much. But when we work with you, it's important. We really want you to continue to eat because we don't want you to lose muscle mass, and sometimes too much dietary caloric restriction causes muscle mass, and especially women, we don't want that. We consult you on proper medication and diet, and we also include some protein shakes in your program to make sure that you're actually getting enough protein not to lose muscle. So the main side effects are nausea, vomiting, constipation, diarrhea, a little bit of fatigue. Muscle loss is something that we try to avoid by proper exercise and nutrition. Dehydration, obviously. Occasionally, some people report insomnia, but it's rare. And all of this gets better with time. In general, they're very well tolerated, but everybody's different. What are the contraindications? If you ask, am I a candidate? Well, you're a candidate if you want to lose weight, number one. Number two, if you're type 1 diabetic, that's the kind that people are born with. From basically childhood, you're a diabetic. You're not a candidate for this. Is contraindicated. Type 2 diabetes is much, much more common. That's pretty much everybody after a certain age. If they're overweight, they have some degree of type 2 diabetes. That's not contraindicated for them. If you're pregnant or breastfeeding, obviously, if you're being currently treated for cancer, if you have an eating disorder, active gallbladder disease, if you have gallstones that are causing problems, pancreatitis, which is inflammation of the pancreas, if you had bariatric surgery in the past 18 months, and if you have this rare type of thyroid cancer, which is called medullary thyroid cancer or Mann syndrome, those are the contraindications. So I think for most people, it's not a problem, but we screen you for all of these as well. I have put together a program for our patients to incorporate this into their aesthetic and wellness journey. As you know, we now have a fully equipped wellness clinic. I have a nurse here that is capable, and I'm monitoring everything that happens. I want everybody to get the access to the best drugs possible. Now, as you have heard, these drugs are getting really, really difficult to come by. Insurance does not pay for them. If you have type 2 diabetes and you're severely overweight and you have really good coverage, they might, but for the most part, they don't. But Tirzepatide is not currently covered for weight loss, so no insurance will pay for it. And even if they do, they're very, very hard to come by. They're on back order. We are getting them from a very, very good source, compounding them, and I have them mixed with something called BPC 157, which is another peptide that is very soothing to the gastrointestinal tract, to your stomach. So it helps with the upset tummy, and it has a lot of other anti-inflammatory benefits. Most people in wellness world are familiar with this peptide. So in our plan, we have a couple of different plans, but the main one is a 2-month supply of Tirzepatide. You get at least 2 visits with our nurse. We screen you, we check your weight, and we analyze your body mass index. We're going to monitor you for the amount of muscle and fat that you have to make sure you don't lose muscle. We include a very, very high quality protein shake that's a month supply. That is very nice because it will give you the nutrients that you need and the protein, while it's very easy to consume and you don't need to have a big appetite for it. And if you're interested, you don't have to obviously, but if you feel like you're dehydrated or you need some nutrition, you can come in and get 20% off on all of our IV therapies that we have. And also, again, if you're interested, you don't have to, but at the end, if you have some stubborn areas that you have that you want to lose weight to get rid of some excess fat and you couldn't with diet, and that's not uncommon, you're going to get 50% of packages of 2 sculpture treatments, which is FDA approved also for localized fat reduction up to 25%. So if you have any questions, please call us or text us at 561-357-2020 and mention webinar for $100 off for the packages. Again, we have a couple of different versions of them. I have both Tirzepatide and Semaglutide available. They are hard to get again, and we're waiting average of 10 days or sometimes 2 weeks for them to arrive. My advice is to go for a consultation right now, and we have Zoom appointments available as well. I've just set it up. And please try to make your appointments as soon as possible because these drugs are going to get harder and harder to get. And I want people to have access to them by the new year because I know people want to, a lot of you want to start your weight loss journey at the beginning of the year when you have your weight loss resolution or New Year resolution. So it's better to start now. So when the new year rolls around, you have your stuff available because again, it takes a while to get these things. We want to set you up and set you up for success, do the proper consult, screen you, and we hold your hand. I like to say we're not an Ozempic meal because I see that a lot of different places in med spas, unfortunately, are offering questionable products. These are not products to be bought online. Please don't do that. I've seen some scary things being sold. I just had a patient in my office the other day that was paying a lot of money for a month on semaglutide that she picked up at a med spa, and she didn't lose any weight. So I was just shocked because I was on it for a week and I lost 4 pounds. And I would caution you against all of that. I think you should go to a trusted source. And we stand behind the product. And obviously, I wouldn't offer anything other than the best. So with that being said, call us if you have any questions. And I'll try to get your appointment as soon as possible. We're already filling very quickly. And Amber is not with us every day. So it's a little hard to get in with her. Thank you so much. I appreciate all of your time. Take care.